Hi, welcome to Beaufort Memorial's Spine Program Preoperative Education class. My name is Dana Aiken. I'm the Total Joint and Spine Coordinator here at Beaufort Memorial. Today you're probably attending this class because you are scheduled for an upcoming back surgery. Before having surgery, it is important to understand the basics, the area you're having surgery, the reason you're having surgery, and just a couple things that you might want to talk to your surgeon about prior to your procedure. We are going to go over some risks and ways to reduce some of those risks and post-op complications after surgery. Before surgery, you can expect a couple of things. We will do some preoperative workup. We will check some labs. We will send you possibly to our preoperative assessment clinic for further consultation and clearance prior to surgery. Some things that we're looking for: your iron levels, any infections, staph infection. If you do become MRSA positive or have a positive result for MRSA, we do have a treatment that we put into place prior to surgery. We check for cardiac issues and just overall general health before having the surgery. A nurse will also review your health history and medications in detail prior to your surgery. You can expect a phone call from the preoperative nurse to go over all of these things with you. When checking some of your levels, if you have a history of anemia or you've had a blood transfusion in the past, you've taken iron in the past, you might get a referral to our blood conservation program. Prior to having surgery, we'll review everything, and if we feel that you are a good candidate for this program, you will possibly be recommended to receive oral iron or possibly even IV iron. Your blood conservation coordinator is available to you if you have any questions. The number's here, so please don't hesitate to reach out. So talking about some of the risks and possible complications after surgery, one of those is the surgical site infections. You can follow along in your joint connection or spine connection resource book if you've already received that. Everything that we're talking about today, you can refer back to in your book. So reducing the risk of surgical site infections, one of the ways to do that is just to maintain good overall physical health. Eat nutritiously, stay hydrated, control your blood sugar if you're diabetic. We will review your A1C and make sure that your blood levels or blood sugar levels are where they need to be. Your blood sugar contributes to the risk of infection and wound healing, so we want that to be as optimal as possible. If you become ill from now until the time of your procedure, please notify your physician as soon as possible. We also will go over the shower prep instructions and the antiseptic soap that we want you to use 5 days prior to surgery. So to reduce your risk of infection, we recommend using the HIPAA Cleanse soap prior to surgery. We want you to use the soap for 5 days, including the day of surgery. The directions to use this: for 4 days prior to surgery, you're going to shower as usual using your regular soap and water. When you're finished showering, rinse off. We recommend that you turn the water off, then grab your HIPAA Cleanse. Start in your surgical area if possible, staying away from your face and your genital areas, so mostly from the neck down. You want to use this soap and leave it on for a couple minutes. Sing your favorite song, whatever you would like to do, and then you'll just rinse off as usual. When you start this regimen, we recommend that you put on clean clothes and get into a bed with clean sheets after as well. Don't sleep with any pets. They might have things on them that they carry that can get into your bed or onto you and could be a risk for infection. Including after surgery, it's very important while your wound's healing not to sleep with pets as well. Repeat this process before coming to the hospital on the day of surgery, so your 5th use or 5th shower should be the morning of surgery, if possible. Do not wear any deodorants, lotion, powders, or perfume the day of surgery as well. If you're someone who's usually sensitive to soaps or lotions or things, you might want to test out a small spot or area on your skin. If you are sensitive to this HIPAA cleanse, you can just use like an antibacterial dial or something like that. But definitely make sure you are doing something. We also like to optimize you and get you into the best shape possible before surgery. So one of the ways that we are hoping to reduce some post-op nausea, vomiting, low blood pressure, and dizziness is our Ensure pre-surgical pre-op nutrition prep. So this is just to help your body prepare for and recover from surgery. We recommend drinking this Ensure pre-surgery clear carbohydrate drink prior. We want to make sure that it's clear. We do sell these in the hospital gift shop and in our cafeteria. You can you should be able to get them on Amazon as well, or at some of the local drugstores. If you're not able to find this particular drink, we do have an alternative recommendation for Gatorade or Powerade. No red in color, but also make sure it's clear. So the directions for this drink: on the day before surgery, you're going to drink 1 10-ounce bottle prior to midnight the night before surgery. Still nothing to eat or drink after midnight. And then on the day of surgery, at least 2 hours before your arrival time. So not the time of your surgery. We want you to drink it 2 hours before. Don't drink it in the car. Don't drink it once you get here. We want to have that nice 2 hours in between. And you want to drink, again, 1 10-ounce bottle. And drink it quickly within about 5 minutes. Another way that we want to increase your wound healing, reduce your risk of infection, is to focus on if you smoke, to please stop. Cigarettes and other forms of tobacco carry toxins that affect your body's ability to transport oxygen and heal properly. If you do smoke, the recommendation is for you to stop using nicotine or tobacco at least 30 days prior to your surgery. In your book, you will find a pre-op checklist. The checklist kind of puts everything that we're recommending and talking about, all the things that you need to do to prep for surgery, kind of puts it in an organized list, an organized timeline as well. So a couple things on your list. Again, the nurse liaison or your provider will instruct you when to stop your medications. You can refer back to your manual as well. The manual lists some general recommendations, for instance, any herbal supplements that you might be on, fish oil, the vitamin A's and E's. Some of those things can increase your risk for bleeding, so we recommend those to be stopped 2 weeks prior. There's also in your book, it talks about any anticoagulants, stopping them 7 days prior. No use of NSAIDs, ibuprofen, Aleve, naproxen, anything like that can also increase your risk of bleeding. So those are just recommendations and general recommendations. You might have specific instructions based on the reason why you take those medications. So make sure that you are aware of what you take, why you take them, and make sure that you have a conversation prior to surgery with your physician and your pre-op nurse on when you are supposed to stop your specific medications. There are also some diabetic medications that need to be stopped prior, weight loss medications, things like that. So make sure that you're asking those questions. It is also on your pre-op checklist to remove fake nails and nail polish, make arrangements for transportation to and from the hospital. You will not be able to drive home. You also will not be able to drive while you're in recovery and healing and on narcotics. You will discuss with your provider when you will be cleared for driving. So go ahead and make some of those arrangements, especially if you have post-op appointments and therapy appointments, things like that. You may need assistance at home from loved ones. We recommend your coach, first mate, family members go home with you and help you through your recovery process. You will need a front-wheeled walker for ambulation, so go ahead and start thinking about that. Have you had one in the last 5 years? that insurance covered. Usually insurance will not pay for those if you have had one in the last 5 years, so you might need to purchase one. We do have the lending room across the street from the hospital that you can get one from as well. So again, just start thinking about those things that you might need after surgery. Physical therapy will most likely be postponed until further along in your rehab, usually maybe after your first post-op visit. You want to make arrangements for your home and the convenience and safety of your home. Go ahead and do those things now. Your family members, make sure there's room for your walker. Make sure that there's no items for you to trip over, fall hazards. Are things close by so that you don't have to bend or reach or twist for those items. And go ahead and pack your bag. Usually these are at least a one-night stay. Sometimes you will go home the day of surgery. That is also another question to ask your provider and discuss at your pre-op appointment. But bring a change of clothes, something comfortable. We like you to get into your regular clothes even the day of surgery. If you have a CPAP or BiPAP machine that you need, go ahead and bring that, phone, chargers, glasses, cases, anything like that. On the day of surgery, again, don't eat or drink after midnight or as instructed. You can take medications that the pre-op nurse told you can take in the morning with a small sip of water. Drink your 10-ounce bottle of Ensure pre-surgery clear drink 2 hours before arrival time. And again, drink it quickly in less than 5 minutes. Do your HIPAA cleanse shower the morning of surgery. No deodorant, lotion, powders, or fragrances. No nail polish or fake nails. You are going to receive a call the day before surgery letting you know your arrival time. Usually it's in the afternoon between 2 and 5, but they will call you. That's also an opportunity to ask questions for any last minute. What medicines do I take in the morning? If you just need reassurance, you can ask at that time as well. When you get here, you'll be taken to a holding area and prepped for surgery. Your anesthesiologist and your surgical care team will stop by and talk to you. Your surgeon will stop by and talk to you. So again, if you have any last minute questions or reassurance that you want to talk about, write those down and bring them with you, because it's going to be a busy day and an early day usually. So just have those ready to go for you to ask your questions. So after surgery, what are you going to expect? You will recover in the PACU. The PACU is not an area that your family members are allowed to go into, so they will be waiting in the waiting area. Your surgeon will usually talk to them after surgery. It will be noisy when you wake up. You'll see possibly other patients in the recovery room as well. You'll have a lot of equipment attached to you, blood pressure cuffs, things on your fingers, oxygen, foot pumps, or something squeezing your either your calves or your feet to increase your circulation. You possibly will have a drain as well, and then you could even have a brace for the cervical patient. So just know you're going to wake up with a lot of things attached to you that you didn't have before surgery. After surgery, again, you will either be discharged home right from the PACU area, or you would be admitted to the 4th floor, the spine unit. Your recovery will begin right away. If you've met your discharge goals related to your procedure, you will go home directly again from the recovery room. Otherwise, your family will be given your room number and they can bring your things to the 4th floor. They are also welcome to wait in your room as long as your room is ready. You will have specially trained nurses to care for you that are familiar with spinal surgery patients. They will perform extensive assessments. They'll monitor your vital signs, and they will just make sure that you're going in the right direction. We will work with you on your incentive spirometer, your deep breathing and coughing. That is to keep things moving in your lungs to help prevent pneumonia and just you're not mobile, so that kind of simulates the same as if you were, up ambulatory. We will monitor your diet, probably advance you slowly based on your doctor's orders and recommendations. Usually you start with clear liquids and you're slow to progress to solids, especially depending on the type of surgery you had. Again, you may have braces. You can see some of them pictured here, and that's usually for the cervical patients. All of that will be based on the orders that your physician provides. For your daily activity, again, we are early to mobilize you. You will ambulate, at least get up and move around the same day of surgery. Physical therapy will work with you, nursing will work with you. If your doctor ordered a brace and told you to bring it with you, please do that. We will also provide some adaptive equipment, the long handle sponges, shoehorns, things that you might need to keep and manage your precautions. You will not be allowed to bend, lift, or twist. You will be taught how to log roll to get in and out of bed, and no prolonged sitting, and change your positions frequently. Again, in your book, there's some examples of the proper techniques, and this is just showing you how to get in and out of bed properly. Again, following that, no bending, lifting, or twisting. While you're here at the hospital, you will receive a care coordinator visit, our discharge planner. We have dedicated discharge planners to assist you in ordering any equipment or scheduling any follow-up appointments or therapy appointments that have been ordered by your provider. The lumbar surgery patients will need a walker. Any other equipment needs will be discussed with your therapist as they evaluate you. If they feel like you could benefit from something, they will have those conversations. A lot of times, the spine patients, the lumbar patients, like to have what we call a potty chair or a 3-in-1 or a shower chair. Those are, raised over your toilet seat. If you have a low-lying toilet seat, they can be used in the shower to assist you sitting while you take a shower. Those are not usually covered by insurance, and those, can be purchased again beforehand if that's something that you feel like you will benefit from. So some post-op instructions. When you are discharged from the floor, your nurse will go over your discharge instructions. It is a very good idea to include your first mate or your coach, family member in these instructions and have them hear them. You're going to have a lot going on, possibly, have just taken pain medicine that makes you a little drowsy. So it's a really good idea to involve your first mate, your coach that's going to be helping you at home. So you'll keep your incision clean, dry, and intact. Watch for any signs or symptoms of infection. If you had a drain, it should have been removed by now, but that will be an order from your provider. You will want to watch and call your doctor if you see an increase of redness around your incision, have any foul smelling or increasing drainage, and if you spike a fever, that's something to definitely call about. Your dressing you will just want to, again, keep it dry, cover it for any showers, but you do not remove any dressings. Your provider will be the one that removes your dressing for the first time. If you feel that your dressing has become compromised or you need a wound check, please call the office or call the provider before removing any dressing. We encourage you to walk, listen to your body, follow the therapy recommendations that you've learned while you were in the hospital. Wear any braces that you've been given as instructed by your surgeon. Take your medications as prescribed. Your narcotics can cause constipation. You're not ambulating as much as you normally would. The narcotics increase the constipation. Make sure to drink a lot of fluids. Have something at home. We probably have already given you something while you're here, like a stool softener Colace or a Miralax, and just monitor your bowel regimen because that is one of the possible complications after surgery. For low back surgery, avoid any, again, bending at the back, twisting and lifting. Be mindful of your body mechanics at all times. Don't lift anything greater than 10 pounds and no pushing or pulling. All of this will we will go over with you while you are here as well. For neck surgery, again, no lifting, pushing, or pulling as well. So when do you call the doctor, or what's normal? When you get home, again, you will have gotten a lot of information at one time. It's important to ask questions while you're here, but also know the baseline of, how you feel when you leave the hospital. And if you have any changes, you and your family first mate coach definitely reach out if you notice any of things. So when is it appropriate to call 911 and go to the ER? Chest pain, changes in mental status or alertness, if you fall and have the inability to walk, if you have difficulty breathing, loss of bowel or bladder control, if your incision opens, those are definitely reasons to seek care immediately. Other things that might be not as emergent, but something you definitely need to alert your provider's office for, or your provider for, sudden increase in pain, drainage, or redness around the incision. Again, pain, you have probably by this point know what it feels like, and you've hopefully gotten a good pain management regimen going. So if you're taking your medicine like you're supposed to, you're doing everything they said, and you just have a sudden increase in pain, that's something to call for. You might have a little drainage when you were here, and your redness a little bit is normal. But if you have, again, an increased amount of drainage or redness or anything that you're worried about, it's always best to call and just get it checked out. If you have a change in color or any odor in your drainage that you didn't have before, that's something to check. If you have pain, again, that's not relieved by your pain medicine, that would be something or a different kind of pain, a pain that you haven't felt before up until that point. That would be something to let them know about. If you have a fever over 101, if again you were to fall with increased pain or decreased mobility, a new weakness in your arms, legs, or difficulty walking. Again, any changes that you didn't have when you left the hospital, that would be something to notify them for. If you're a cervical patient, had neck surgery, any new difficulty swallowing would definitely be something to call for. And if you haven't had a bowel movement in about 4 to 5 days, especially if you are taking some of those recommended medications to kind of help with that, that would be something to just let them know about. So what are some things that are normal? The warmth around the surgical area with a clean and dry incision, that's normal. Mild bruising or swelling is expected. Feeling tired, but can take short walks frequently. Pain that can be controlled with the pain medicine. Ice, make sure you're using your ice. And then position changes, again, going back to, we don't want to do anything for too long of a period of time. And then a bowel movement every 1 to 3 days. So if you're somebody that has a bowel movement every day, but now you're having it every other day, again, you've had some changes in your body and your routine, so that's normal. But if you are not having them, or they're going more than 4 to 5 days, that's when you would want to notify someone. You also have, for patient-reported outcomes, you have probably received by now an email or text message asking you to participate in a survey that is coming from us. It is to help track your recovery after surgery. You'll be asked to complete some assessments with some questions just about your physical recovery, as well as your just overall improvement with your quality of life. That's just individual, your answers. There's no right or wrong answer. It takes about 5 to 15 minutes. If you want to communicate directly with us through that, you may. It is also a way for us to track you and help us make improvements in our program, monitor you, and we will reach out usually preoperatively 3 months and then about a year out. So we just want to check in with you, make sure that you're doing well, and that the surgery is doing what it needed to do. So if you could participate in that survey, we would be very appreciative. Okay, so you have a lot of information. You have your book. You've watched the video. We have in your book, there is a whole list of resources. My number is in there, my email, it's on the screen here as well. If you have any questions, I am your resource before surgery, during surgery, after surgery. We just want you to feel really prepared for this. We want you, when you go home, to not feel like you're going home alone. So definitely reach out if you have any questions. Your provider will have someone on call 24 hours a day as well, and you can always reach out to the 4th floor, the spine unit. If you need anything, please don't hesitate to reach out, and we look forward to getting you back to enjoying your quality of life.